Hi and welcome to my talk. I am Johannes Weinberger, the Director of NGS Laboratory at ARESdb. Today I'm going to talk about our hybrid capture assay that we developed on the Twist platform based on our ARESdb database. This is our forward-looking statements disclaimer. So first let me introduce you why we think it's a good idea to work on antimicrobial resistance testing and improve the diagnostics and testing in this area. As you might be well aware, antimicrobial resistant strains and pathogens are one of the major 21st century healthcare problems. Also, the WHO recently published several reports about the importance of this issue. Millions of people are already affected by antimicrobial resistance, and it causes a lot of direct and indirect healthcare costs. So let me explain what we think is the major issue and the major shortcomings in the field. The standard diagnostics of the standard of care in diagnostics is culture based, and culture is labor intensive. It can be subjective. Also, time to result can be suboptimal. Sometimes the culture is also negative, so you miss certain pathogens. Multi-infections can be a problem. And as soon as antibiotic treatment did already start, sometimes there's limited use of these diagnostics. In the USA, there was a study conducted with 499 patients regarding treatment, and the study showed clearly that only a fraction of the patients have been treated perfectly. So 63% were overtreated and 22% were undertreated, which is a clear indication that improvements in this field have to be made. So let me introduce ARESdb to you a little bit, what we are capable of doing, what is our research focus, and what we can offer for customers already. So our already available services are primarily based on bacterial isolate sequencing. So we do whole genome sequencing of bacterial isolates. We have validated a workflow for that and also published in line with clear requirements. And based on this whole genome sequencing data of the bacterial isolates, we have an analysis pipeline that is connected with our ARESdb database. In this pipeline, we can detect a very comprehensive set of AMR markers, and we can also do predictive AST. For those of you who are not aware what this term actually means, predictive AST is in silico prediction based on the whole genome sequencing data to predict antibiotic susceptibility and resistance that you can compare with phenotypic results of the culture. And we also showed that this has a very high concordance, and our prediction is very precise. We also showed that this can be done for short-read Illumina sequencing data as well as long-read ONT data. And our newest development is a capture panel that we developed based on ARESdb on the Twist Bioscience platform. It is capable to capture AMR markers from native samples, so you don't need to do any culture. And we also investigate currently if predictive AST is also doable on this data set. And as you might see, the first preliminary data look very promising, and I will show you some examples in the slides below. And everything that we do is enabled by our ARESdb. It's a very comprehensive database for AMR markers. We combine them with machine learning models, and the result is an industry-leading system and analysis pipeline for the predictions. ARESdb is also licensed from CLC, a company from QIAGEN you might be aware of. So you can also use it via the CLC workbench. And yeah, we also have a comprehensive IP portfolio that covers our AMR markers. Now I want to show you the two different workflows. One if you start with bacterial culture, and one if you use the culture-free approach. As most of you are probably well aware of NGS workflows, I don't have to explain that in detail. So you start with the culture, you have a bacterial isolate, DNA extraction, then we do whole genome sequencing, library preparation, the sequencing itself, and the data analysis. And in this pipeline and workflow, the results that you get are pathogen IDs, like the taxonomic identification of the pathogens. You get all the AMR markers that we can find in the strain. And you also get predictive ASD results for more than 100 bug and drug combinations. And now let's have a look at the culture-free capture assay. So you again start with samples that can be all kind of things, environmental samples, clinical samples, blood, urine, whatever you can imagine. And then we start directly from DNA extraction. And then, of course, you have the problem. For example, if you think about blood, there is high human background. And if you do shotgun sequencing, then all you see is human background. And in order to see what you're actually targeting for, you need to do an enrichment. And we decided to go for a capture assay. And we found that up to 10 to the 6-fold enrichment is possible with capture assays based on the Twist platform. So for most samples, you get a very high percentage value of on-target reads of your whole sequencing output. And in the data analysis part, this kind of data is way more complicated as if you would work with whole genome sequencing data. It's because of the fact that the markers can, of course, arise from, yeah, not only one specific strain or isolate, but from all other species and pathogens that are in your native sample. So it's very hard to connect markers with a specific individual clone. So for that, we need to develop new and more sophisticated machine learning models. And also the database has to be expanded, and we are currently very successfully working on that. So the result, if you would want to work with this workflow with us, you would get a pathogen ID, AMR markers of all the markers that are in your native sample, and predictive LST is currently under development, and I will show you some preliminary data. And now a few statistics to demonstrate the panel design. The probe space is around 4 million base pairs, target space that we cover around 8 million. We cover in this panel 8,090 sequences or markers. One of these markers has an average length of 1,028 base pairs. We cover 99.8% of the marker space with this panel. and the mean depth is 2.1-fold. I also want to mention that this panel that I describe here is particularly focused on AMR markers, so there's nothing else on it, no text ID, no virulence factors, but we also have other panels that we work with if we want to detect the text ID directly with the panel. Alternatively, you can always do 16S sequencing for pathogen detection from the native samples. So, and now I want to show you some examples what you can use this workflow for. So what we did do is to test the approach for environmental samples. These environmental samples were particularly problematic as it is extracellular DNA, and therefore there was a very low concentration of samples. But still, we did try to do shotgun sequencing to identify how many markers we can recover. And as you can see, for all the samples, only a few markers were able to get covered. Also, the marker coverage was did vary a lot. And then we decided to use the same samples with our capture assay. And as you can see, we can find way more markers now for every sample. And also, most of the samples even got a marker coverage of 100%. So a huge improvement. The only problem with the samples is that you more or less cannot get any information about the ground truth. So you don't know what is really in your sample in terms of AMR markers. So in order to check specificity from our approach, we decided to use 2 samples and process them in triplicates. And for every triplicate, we counted the markers individually, how much we can find. And then we used overlap analysis that is described here via this Venn diagram. And you can see that it's still very, very specific. And this is particularly interesting because, as I said before, the concentration was very, very low for these environmental samples. Twist, for example, says 5 nanogram per microliter for this protocol is minimum requirement. And we still thought, okay, let's give it a try. And we adjusted cycle numbers, so in order that you can get a signal in the QC of the library. And it seemed to work fine, especially if you think about if you have such low concentrations, the sampling error in between the triplicates might also be very high. So the key takeaways are that even if sample concentration is very low, the marker recovery is pretty specific, and also the protocol is very robust. And the second example that I want to present you today is from septic urine samples. For this project, we used 38 septic urine samples of human origin. We did a whole genome sequencing of bacterial isolates. So these septic urine samples are supposed to be mono-infections. This was confirmed by culture. And we also confirmed the AST profile via culture. And we did also shotgun sequencing of the native samples as well as sequencing of the enriched data. And what you can see here in these diagrams is that the on-target reads in this blue line are from the shotgun sequencing. You see that on-target markers that we were actually looking for, there were only a couple of % at best that were reads that we could use. And for the same samples, if you compare it to the data that we get from the enrichment panel, you see that between 30 and 70% on-target reads for every sample, which is, of course, a great improvement. It also saves a lot of money. Yeah. And the second diagram shows if we assume that we would have a perfect enrichment, meaning that 100% of all reads are on target reads, which is indicated in the green line, how close can we get with our enrichment approach to this ideal situation that all reads are on target? And even if we have certain fluctuations, of course, I think the performance is not too bad. And now on the next slide, you can see marker recovery. Of course, we are mostly interested how well we can recover markers for AMR, because this is our main interest. In order to analyze that or rate that, we counted the markers that we found for the whole genome sequencing data for the bacterial isolate, which are listed here for every sample here. And we checked and compared it with our hybrid capture sequencing data. And as you can see, we are very, very sensitive. So every marker that we should find can be basically found or is found. The only problem that you have is in native samples in comparison to bacterial isolates, you also have background bacterial species and strains in there. So occasionally, even if the samples are considered as mono-infections, occasionally you can find something else. And then for these kind of samples, this would be one example, you find all the markers that you expect, but you also find a lot of other markers. We call them false positives here, even if they might be present in reality. So that's why precision can sometimes look bad, but in general, also the precision is performing very well. And now to my last slide. This is a first preliminary data about predictive ASD from capture assay data. As most of our mono-infection samples were Escherichia coli, we decided to use a model or construct a model for Escherichia coli and test it for 10 compounds. And as you can see here, the balanced accuracy, which is the more important value here, because it's rather imbalanced. As you see, the true negatives are way more than the true positives. But it still indicates that we are very well performing here. It looks very promising, and we will expand our future research on this area so that we can, at the end of the day, hopefully deliver the same predictive ASD performance as for whole genome sequencing data. And key takeaway is that it works already pretty good for E. coli with 10 compounds, and that we will keep working on this. And with that, I want to close my talk. I thank again Twist Bioscience for the invitation. It's a pleasure for me to be part of your great conference series. I really enjoy it. And for all of you listening to the talk and you work with AMR and infectious disease testing, please reach out to us or to me personally. We are experts in the field of antimicrobial resistance. Most likely we can help you somehow. Thank you.